Fitzpatrick, you're recognized.
Thank you, Mr. Chairman. Thank you to our witnesses for being here today. In my home state of Pennsylvania, year after year, more seniors are choosing to enroll in Medicare Advantage plans, with approximately 54% of seniors on Medicare now enrolled in Medicaid Advantage plans. These plans have been proven to be significant cost savings for our seniors. Just in my home state of Pennsylvania, MA beneficiaries spend approximately 37% less than Medicare fee-for-service annually, with an average of over $3,000 in savings on out-of-pocket costs and premiums. There's also health outcomes that should be highlighted. 70% fewer hospital readmissions for MA beneficiaries relative to the traditional population, and lower rates of unnecessary medication usage. There is nothing more important than ensuring our seniors have access to affordable and high-quality care. First question for Ms. Maroney. Can you speak to how Alignment Health coordinates with physicians and care teams to ensure the highest quality of care is provided to your beneficiaries? And can you address how offering special needs plans, including benefits such as meal plans, has impacted patient care?
Thank you for that question. The whole team has to be involved. The physician, we actually have critical intervention teams specifically for your higher risk patients, as well as people that are just aging into Medicare or into the program specifically as they're starting out. So depending on the age and stage of or the diagnosis of that individual is a development of a care plan that is specific to that individual consumer or beneficiary, as well as making sure that the physicians, starting with the primary care and or if there's an interdisciplinary team as a whole, is integrated in that plan. So it's putting a very proactive, integrated approach to care, no matter where they are in their age or stage, specifically, or diagnosis, to address that. Our ADK, our admits per thousand, are sitting at 149 ADK in comparison to over 200 plus when you look at the basic fee-for-service program. Our readmission is in the low numbers, specifically in comparison, about 4 to 5% better than Medicare fee-for-service. And so we look at that, and then you can offer additional benefits above and beyond traditional Medicare that are very rich directly to that Medicare beneficiary, so whether utilizing getting food or getting special vitamins or getting fitness or dental, hearing, among a vast variety of packages that are customized specifically for that constituent.
Thank you. And I want to note, Medicare Advantage can be strengthened, must be strengthened, specifically through modernizing approaches to administrative challenges. Mr. Chairman, I'm very glad to see prior authorization being addressed by the industry in an effort to streamline and improve patient experiences. The potential for administrative burdens delaying access to care, we've all seen it, we've all heard about it, especially medically necessary care, must be taken seriously as more seniors choose MA plans. At a time when too many providers are already stretched thin, therapy requirements place an additional administrative burden, particularly on independent and community-based practices. Many providers report experiencing high administrative challenges when navigating varying MA plan step therapy policies for physician-administered drugs. This often requires hiring additional staff and adds hours of administrative work each and every week. Dr. Miller, final question for you. How might this administrative process be improved so providers' time and resources are more focused on delivery of care rather than step therapy requirements on prior authorization delays?
So for drugs in particular, putting the formulary tiering into the electronic health record, showing where the beneficiary is and their deductible, showing what's not formulary, showing what requires a prior auth, automating that data submission. And I think that the managed care industry has the funds to do that. Hopefully now they have the political willpower to do that, given that we've now had probably 20 conversations about prior authorization amongst all of my colleagues and I over the past couple hours. And I would say, Medicare Advantage plans, they spend around 72% of their rebate dollars on reducing beneficiary cost sharing or premiums for routine medical services. So that means, and that's A, B, and D benefits, so that means that there are other dollars in there that they can use to promote and improve IT administrative process.
Thank you. Thank you all for your time. Mr. Chairman, I yield back.